Here we go. Hello, everyone. Today, I would like to introduce to you Teodora Szomoru, an orthodontist from Timisoara, Romania. Teodora, thank you so much for your enthusiasm and for your presentation.
Thank you very much for having me. It's really a great honor to be here with you.
Teodora will share with us today a clinical case about Invisalign before prosthodontics. Teodora, do you want to give us a tiny bit teaser about what is your presentation about?
Sure. So, as you said, I'm an orthodontist and I'm really fond of digital treatments. It is actually a new way of treating patients. So we have a lot of questions regarding how far can you go with an aligner therapy. So this is what I meant with this presentation, to show an old case of mine and how you can finish it with Prosto afterwards.
Wonderful. Really looking forward to seeing it. And we invite everybody to leave a comment, ask questions for Teodora, and we see you guys online. Thank you.
Thank you
Bye-bye.
very much and enjoy.
Thanks.
Hello, I'm Teodora Szomoru. I'm an orthodontist and I would like to share with you today one of my cases which I treated with Invisalign, an adult patient which I had to prepare for prosthodontics. Um, the aim of this presentation is to show that we can treat with aligner therapy, which is usually digital, different degrees of difficulties in orthodontic cases. Also, I would like to give some tips and tricks about how I prepare my digital treatment plans, and in the end talk a little bit about stuff that I would do different today. uh, you know that in orthodontics, keeping track of the cases is really important because uh, treatment usually takes about 1 to 2 years, maybe even more if it's really complicated. So it takes a lot of time for us to draw certain conclusions. Okay, guys, I will share my screen with you and I will try to talk here in the back. Share. Mhm. So I called it Invisalign before prosthodontics. Usually in my office, the patients which I treat with Invisalign are adult patients. In adult patients, we all the time we have missing teeth or aesthetic problems, and it's never finished just by orthodontics. It always has to be followed by implantology and prosthodontics. So this is always a challenge for us orthodontists because this has to be a teamwork. We have to work with the doctors that take over the case after us and bring it to the finish line. So here we go. These are the pictures of my case. This is a woman in her 30s. She came for an orthodontic treatment, and her main request was not to use braces. She really wanted to have something as invisible as possible. We assessed the case and we decided to go with Invisalign. Okay, so let's see what we have here, what the situation is. So in the upper arch, you see that we are missing a lateral, which is tooth number 22, that brought a lot of aesthetic problems. I cannot share with you the picture of the face as I'm not allowed, but I can tell you that the midline problem is on the upper arch. So the lower arch has the midline aligned with the midline of the face, but in the upper arch, due to the lack of tooth, all the teeth migrated to the left. Also, you see that we have here like everything: crossbite, crowdings, um, some more. Yeah, here you can see better the crossbite, and also On the right side, you can see that the tooth 1-6 extruded too much, and now it's actually impossible to recreate an arch with the situation like this. We need to place that tooth back into his position and to gain vertical space. Also, the space that we have now for the tooth 2-6 is too small to place an implant, so we will have to work there as well. This is the occlusal view. So you can see that because of the crowdings in the lower arch, it brought also a problem of keeping the right hygiene and some old fillings with decays here and there. I will not go too much in detail concerning odontotherapy. I will stay to the ortho. Okay, so first step, we need to take an impression. I really like the fact that Invisalign is a digital treatment plan because I treat patients in my office, but I also treat patients with collaborating offices. That means that I never actually see the patient in real life. I just work with the scan. I think it's really more comfortable with the patient. It's faster for us. And we can actually, when you do a first scan, you can from the beginning show the patient an idea of how his teeth are going to look. So we do it digitally. Okay. After we do the scan and we send it to Invisalign, they give us a proposition of a treatment plan. Usually, I never accept that. So it means that I have to start collaborating with the technicians. So I send different messages. I ask them to do this and that, and then they send me new treatment plans. Usually, it takes about 3 or 4 treatment plans until I get to something which I believe that it will actually that it's possible that that treatment plan to actually happen into the patient's mouth. Because always keep in mind technology is nice, but this is a digital software treatment plan, and then we have the patient's biological environment, which is different from patient to patient, depending from the bone, how much cortical, how much medular there is. So there are a lot of factors to keep into consideration. Okay, I will show you what this is actually the first treatment plan that I accepted. Okay. So one of the goals that we had was to create space. I needed to place the tutu back here on the position and shift all the teeth back where they belong. So for this, we use basically 3 things. We do expansion, we plan IPR. IPR means interproximal reduction, and you see it here with 0.2 or 0.3. This is one of the beautiful things with digital treatment plan. The fact that you can say exactly how much IPR you will need so you don't do too much and leave the patient with spaces between their teeth, or you just don't do enough and then you cannot align the teeth properly. Okay. In the beginning here you see the teeth are moving just in the back, and then at the end of the treatment we start to move the upper teeth. And here we have the initial situation. I will show you this from all the angles possible so that you would understand exactly what we decided to do here. What you see here, 45, is the number of aligners with which we planned for this patient. This was a case which I started 4 years ago. So back then, we still asked the patient to wear every aligner for 2 weeks. Today, we don't do like that. Maybe 10 days, we go for 10 days only. If we have really complicated movements, then we go for 2 weeks. This is from the occlusal point of view. You will see here on the first quadrant exactly what I mean by distalization, because almost half of the treatment is happening here. With Invisalign, it's not so much possible to do block distalization. We have to do tooth by tooth. So look, you see, first we just move the 1/7. Only here, when we have enough space, we start to move 1/6 and then the others. Also in the lower arch, we perform the IPR and we plan some expansion in order to also gain a nice arch form. Mhm. Okay, here on the lateral side, you can see what I've told you about this tooth, which is 1/6, which is really, really extruded, and we don't have enough space to place an implant here. Um, Usually with braces, in order to be able to produce the intrusion, we have to use mini implants. In this case, I didn't use mini implants. We discovered that if we plan the clean check properly, then we can use the aligners to produce the intrusion. So when I did this treatment plan, I asked that the aligner here on the lower arch where the tooth is missing, not to have it follow the gingiva, but to have it like in the shape of a tooth. It's called in Invisalign a pontic. So you just ask for them to place a pontic here. This means that the treatment will bite on that pontic for 2 years and he will produce the intrusion himself. Of course, I also plan it in the clean check, but the movement is helped a lot by the pontic. Also, you can see here these blue dots, which we use to give the patient elastics. These are used for some anchorage. Mhm. Okay, so what do I mean here by after the first clean check? As I told you, Invisalign is a digital treatment plan. So you see there is software, and you can consider that it's a really good outcome if 95% of the stuff that you plan are actually happening in the patient's mouth. There are a lot of things also of things to take into consideration, like how well will the patient wear the aligners, if he is compliant with the elastics. Everybody says they're compliant, but sometimes it happens, sometimes it doesn't. And then it's also the fact that every patient has different bone and different metabolism, so it's for sure it never happens 100%. But Invisalign is giving us the opportunity to do this fine tuning, which is called case refinement or additional aligners. It means that we do the scan again. So at this point, when we are 90% ready, we have the patient into the office and we assess everything. We also request for a CT, a computer scan, which I sent to the surgeon, and he tells me also details regarding space, if he has enough space to place implants here. As you can see, we had that, so the movements happened really good. We had some really difficult movements to do here, and really wide. What I'm really concerned about is the incisors, the 1-1 and 2-1, because they did this tipping movement. So it's a little bit like this. Um, and the implantologist said that he would need us to repair this because he needs the space between the roots to place an implant. Okay. So on the laterals, you can see that 1/6 actually intruded as I predicted just by biting on the pontic. So now we have enough vertical space for tooth 4/6. we have a little bit of an inocclusion here, and this usually happens when we have crossbite patients, because we have to be able to make the jump. Okay, and this is the occlusal view. Now we have some more space for 2-6 as well. The crowding on the lower arch is basically solved. We don't have so much to do now, so always the case refinement or the additional aligner have fewer numbers of aligners. The patient has already been 2 years in treatment, and we don't want to prolong it very much. I decided here on the frontal teeth on 1-1 and 2-1 to ask for optimized attachments. Optimized attachments have these active surfaces here and here, and so when the aligner pushes on them, it makes it possible for the root to tip. We have, I added here some extra IPR, interproximal reduction, in order to be able to settle the bite. Okay, so look here how they are making the tipping. Okay, this is the occlusal view. You will see not much is happening here. We don't want to move too much the teeth in this stage. What is new are these bite ramps, which now I would place from the beginning of the treatment, because they help with making the jump on the cross bite, and also with the settling of the teeth on the lateral side. You can see here the vertical space looking really, really nice. Okay, so this is the result after prosthodontics. After implant, you see here that now we have tooth number 2-2. It was a megagen implant and a hybrid abutment with an Emax crown. Also, the surgeon added some gingiva, some graft tissue, in order to be able to reproduce the papillas to make it look nice and symmetric with the other side. This is from a lateral view, and the arch. So you see, the crossbite was resolved. The midline shifted. I still have 1.5 millimeter, which we left it like this because the patient was really satisfied with the results. The aesthetics were much better, and I just didn't think it's needed to force the situation for this. Look, the shape of the arch is really nice, like semi-round arch form. And also the patient has much more space now to do a proper hygiene. Okay, so the first picture is the beginning of the treatment. In the second picture, you see the results after ortho and then after implant. Of course, there are a lot of treatments which I would do different today. Probably I would do 416. Just a second, I will share again. Okay. So this was the initial situation. I thought a lot about this case these days. So probably if I would do it today, I would plan more distalization here, or I would help it with a mini implant. You can see here that the distalization, it's only happening with the aligners, and I didn't help it with anything. I think that this treatment plan depends a lot on the patient, so that he would wear his elastics properly, and you never know if this is going to happen. So um, today I would just place a mini implant and do the pulling with the mini implant. I think it would go faster and it would be much safer, and of course much more comfortable for the patient, because he would not have to wear the elastics all the time. Also, I would go for optimized attachments from the beginning of the treatment, and I would insist more for the patient to also receive some veneers done, because it looks nice, but I think having proper veneers done would look perfect. Okay, guys. So I hope you enjoyed this case. And see you. I will try to prep new ones and discuss it with you. Um, Please let me know if you have questions, or if you think you would do something differently. I would really like to have the opportunity to discuss digital dentistry with anyone. So thank you very much. Bye.